I think one of the things is that in medicine, sometimes we want to find out problems quickly, and so these technologies have come out to help people try to figure out if something's going on.
Okay.
And I think the most important thing is that it alerts them to get medical attention quicker.
Right. So, does your average person wearing a Fitbit or one of these heart? Because a lot of them have heart monitors in them.
Yes.
What should they be looking for, and then when do you step in?
So, most of them have general heart rate monitors.
Okay.
So it's very helpful. Like if you're exercising or just during the day, it gives you an average heart rate that you can have. And I think it's important that for people to understand them, you have to know how to interpret what's a normal heart rate.
Okay.
For some person, a normal heart rate could be 45, and for somebody it could be 85.
Oh.
So it's important to know where you stand, and you should always talk to your doctor about that.
Right, because like you said, everyone's heart rate is different, right?
Yeah.
So in terms of how fit we are, right?
Right.
When do people typically see you, and when do you get involved?
So I'm a cardiac electrophysiologist.
Okay.
The electrician of the heart is what I tell people. And a lot of people, I'm specialized in treating heart rhythm problems. So a lot of people get referred to us when their heart is beating too fast, or it's beating too slow, or they're having passing out spells. And some people have had heart attacks who are at risk of cardiac arrest. So these are the type of people who come to see us. So they sometimes get referred by their primary care doctor. Sometimes they get referred by cardiologists.
When does the heart skipping, sometimes people will say, oh, I felt like my heart just skipped a beat. When does that become something that you're like, maybe you need to see a doctor about that?
So it's a very common symptom, having skip beats. Most people have skip beats. It's what we call benign, which is that it's abnormal but not really causing any problems. But I think it's always important to tell your doctor about these symptoms, because it's better for a doctor who understands whether a skip beat is normal for you and is not causing a problem, or it is causing a problem. So the interpretation of that is very important. So it's always good to tell your doctor about these symptoms.
Yeah. And as far as like what your heart rate should be, is that something that you should talk to your doctor about, like what's normal for you versus someone else?
Yeah, so on average, a normal heart rate is somewhere between 60 beats a minute and 90 beats a minute.
Okay.
But there are some people who have a heart rate of 100 beats a minute. Like my mom's heart rate is a little higher. It's like 100, 110 beats a minute sometimes.
Okay.
And so it's important to know that,
Yeah.
and that might be normal for that person.
Okay. All right. Well, again, Dr. Rao, thank you so much for joining us. This is fascinating. Again, see your doctor if you have any questions about what your heart rate should be. And it's great to have you in studio. Thanks for sharing what you know.
Thank you.